Today I'm talking about auditory processing disorders and what you need to know to provide a comprehensive education. According to the American Speech Hearing Association, recently there has been an increase in professional and public awareness of auditory processing disorders, which has caused many misconceptions and misinformation on methods of treatment. This presentation compiles research from many sources to enhance educator and professional staff that work with children with auditory processing disorders to better understand this disorder and how to treat those individuals. During this presentation, I will be referring to auditory processing disorder as APD. So, APD refers to how the central nervous system uses auditory information. It is a deficit in the ability to process and channel information through the auditory system. It is an auditory deficit that is not the result of higher-order cognitive language or related disorder functions. It may coexist with other disorders such as ADHD, autism, or some other disorders or syndromes. APD cannot be diagnosed from a symptoms checklist. No matter how many symptoms of APD a child may have, only careful and accurate diagnosis can determine the underlying cause. So for the diagnosis to be accurately assumed, an audiologist must make the official diagnosis. They administer a series of tests, and it's typically not diagnosed until the age of 7 or 8 years, depending on the cause. This disorder is also a complex disorder with associated causes and associated syndromes. Sometimes this disorder in the early ages are treated as a speech and language impairment or a learning disability because the characteristics are similar to those of speech and language impairments or learning disability as the child develops. But with careful diagnosis, the audiologist can determine the appropriate methods of intervention. So prevalence on APD. So data to calculate the incidence and prevalence of APD is not available because there's not a universal standardized diagnostic criteria. The diagnostic criteria varies widely, and depending on the assessment and instruments used determines how each child will be diagnosed. There's only estimated prevalence based on the number of cases at a given point in time, specific to studies conducted by the American Speech and Hearing Association. So children, there is 2 to 3% and 7.3 to 96% of children will have APD. So that's a wide range from 7.3% to 96%. But that's done on a case-by-case basis. So researchers who study individuals have estimated the prevalence based on their specific studies. For adults, ages 55 and older, 23 to 76%, and the male to female ratio is 2 to 1. Causes of APD. So there can be prenatal, neonatal causes, neurological causes from disorders, diseases, or damage. There are identified cases of there are identified cases caused by Landau-Kleffner syndrome. Landau-Kleffner syndrome is a childhood acquired epileptic aphasia occurring between the ages of 3 and 10. It presents as an abrupt auditory processing problem that begins as an acquired verbal auditory agnosia in a child who was previously developmentally normal. This just means over epileptic episodes, there is damage to the neurons in the brain. Genetic determinants can also be causes of APD. Age-related changes in the central auditory nervous system functioning can cause APD. Neuromaturational delay secondary to deafness and auditory deprivation. Causes from the central nervous system, such as disorders. These can be linked to specific lesions or disorder, as well as it can be unknown, and it can also be present at birth. Additionally, autologic disorder, disease, or injury can cause APD. Characteristics seen in individuals with APD. Cognitive characteristics are difficult to identify. Many individuals meet the developmental milestones at appropriate times, depending upon the associated disorder or cause of their APD. Academic difficulties are characterized in math, spelling, and reading. Difficulties can be seen in auditory tasks, such as sound localization and lateralization, dichotic listening, temporal processing, and sound discrimination. There are social and emotional difficulties in understanding speech in noisy environments, following directions, discriminating similar speech sounds, request repetition of nonspecific information, and delay in responding during conversation. Physical characteristics, you can physically see a student show their inattentiveness and distractibility because of some of these difficulties in understanding speech in noisy environments and difficulty discriminating speech sounds and difficulty responding during conversations because of these inability to discriminate sounds. It is important for interventions to be evidence-based and administered by speech-language pathologists, audiologists, and special educators. Students should receive one-on-one therapy with a speech-language pathologist to provide intensive intervention for the student, as well as push in services to practice the strategies during class and social activities. Some interventions that speech therapists can provide are direct remediation activities to improve the temporal processing and bilateral coordination. Some listening strategies and background noise to strengthen dichotic abilities can be helpful, and intervention to increase auditory memory and auditory comprehension skills, as well as intervention to increase attention time during tasks. Additionally, multisensory reading programs can be provided to students. Listed below are a few examples of online reading programs that incorporate sight, sound, touch in their programs. Some teaching approaches that should be used to help individuals with APD better access the curriculum are small group instruction, repeat and rephrase of the instructions, top-down or bottom-up approaches should be used, compensatory strategies such as anticipatory, meaning identifying the potential hard-to-hear situations, repairing, which is discussing the ways to adapt in those environments, and teaching the student self-advocacy, so you're teaching the student how to problem solve during those hard-to-hear moments. Some environmental modifications that the teacher could make, they could allow flexible seating within the class, allowing the student to move to the front of the room if not placed in the front of the room, or allowing the student to go to a more quiet part of the room should be allowed for these students. And finally, using alternative and augmentative communication can allow for a multi-sensory approach. The researcher in one of the articles states that the best practices related to augmentative and alternative communication instruction emphasize the use of integrated models of instruction in which augmentative and alternative communication does not constitute a separate component of the curriculum, but instead a means by which students can access the general education curriculum. There are many forms of alternative and augmentative communication that can help adapt and accommodate students with APD. That leads us into the adaptations and accommodations. So these accommodations could be FM system, which is a way to provide the general education curriculum. It can enhance the curriculum for students with APD. So the teacher wears a microphone of some sort and speaks into it, and the student listens with an earpiece directly in his ear, kind of like a Bluetooth earbud or a hearing aid like speaker that's directly at the student's ear. Visual cues and tools are necessary accommodations that the teacher will need to provide for the students with APD who are struggling in comprehension and discrimination of auditory information. Digital hearing aids could be provided to a student where the sound is directly provided into the student's ear. Instructions given step by step. Procedures is needed so students with APD can process and comprehend information. Often giving students with APD written instructions and materials ahead of time will allow the student full access to the curriculum during whole class instruction. Because students with APD have trouble discriminating sounds and processing speech, instruction will need to be given slowly and clearly with the use of the visual tools and with the assistance of the visual cues and tools. This will provide a full access to the curriculum. And extra time to complete classwork and tests is needed, and seating in front of the room is important so the student is not distracted by others, and discrimination is less taxing to the student. Also preparing the student with materials before the lesson begins, giving the vocabulary and concepts to the student so the student has time to review for maximum comprehension. So with this information on the prevalence, causes, characteristics, interventions, and teaching approaches with adaptations and accommodations, You should be able to provide your students with APD, better access to the curriculum, and feel more comfortable providing education to students with APD.